Did you know that endometriosis, a condition that affects 1 in 10 women, can cause a symptom known as endobelly? This is a severe bloating that can persist for hours, days, or even weeks. It's an unseen reality for many, often misunderstood and brushed off as typical menstrual discomfort. But let's set the record straight. Endobelly is far from typical. It's a distinct symptom of endometriosis, and it's different from the bloating many women experience during their menstrual cycle. Endobelly is relentless. It doesn't adhere to a monthly schedule. It can strike at any time, leaving women feeling uncomfortable, frustrated, and at times in severe pain. While the exact cause of endobelly is yet to be discovered, there are theories that suggest it could be a result of the menstrual cycle or the intestines working overtime. Endobelly, though common in women with endometriosis, remains somewhat of a medical mystery. Indeed, this symptom, characterized by severe belly bloating, is different from the usual bloating experienced during menstruation and can persist for varying durations, a few hours, several days, or even weeks. Now, let's unravel the 2 main theories floating in the medical community, trying to explain the occurrence of endobelly. The first theory suggests that endobelly might be a side effect of the menstrual cycle. Here, the idea is that the inflammation caused by endometriosis could be aggravated during menstruation, leading to bloating and discomfort. This theory is supported by the fact that many women report experiencing endobelly during or around their menstrual periods. On the other hand, the second theory posits that endobelly could be a result of the intestines working overtime. You see, endometriosis can cause adhesions or scar tissues that bind the organs together, potentially affecting the intestines' functionality. This could lead the intestines to work harder, leading to bloating and the subsequent manifestation of endobelly. While both these theories offer plausible explanations, it's important to note that they are just that, theories. They provide a starting point for understanding endobelly, but aren't definitive answers. The medical community acknowledges the need for further research to fully comprehend the causes and mechanisms behind endobelly. It's also crucial to understand that endobelly isn't a standalone symptom, but part of a larger condition, endometriosis. Therefore, its manifestation, severity, and duration may vary significantly from one individual to another, making it all the more complex to pin down a singular cause. While we may not fully understand the cause of endobelly, this doesn't mean it can't be managed. Indeed, as we venture into the subsequent scenes, we'll delve into how specialists can help manage endobelly and the keys to coping with this condition. So stay tuned as we unravel the ways to navigate through the enigma that is endobelly. Endobelly may not have a definitive cure, but seeing an endometriosis specialist can make a world of difference. Endometriosis, to many, is a complex maze of discomfort and confusion, and this is where the role of a specialist comes into play. These professionals have dedicated time and effort to understanding the intricacies of endometriosis and its many manifestations, including endobelly. They are equipped with the knowledge and clinical experience to navigate this maze, helping patients understand and manage their condition better. A specialist's role is paramount in diagnosing endobelly. This condition, as we've previously discussed, can be perplexing, varying in intensity and duration from one individual to another. It is the specialist who, through comprehensive evaluation and understanding of the patient's history, can affirmatively identify endobelly, distinguishing it from similar conditions and symptoms. But their role doesn't stop at diagnosis. Management of endobelly symptoms is a long-term commitment, and a specialist is a patient's steadfast companion on this journey. They provide personalized treatment plans, taking into account the patient's unique circumstances, lifestyle, and overall health. This could involve medical interventions, dietary changes, or lifestyle modifications, all aimed at alleviating the distress caused by endobelly. Furthermore, the specialist's guidance extends beyond the scope of endobelly. Endometriosis is a multifaceted condition, often impacting various aspects of a person's life. The right specialist can offer advice and support in managing other symptoms of endometriosis, helping patients lead a better quality of life. They can also provide resources for emotional and psychological support, recognizing that dealing with a chronic condition like endometriosis can take a toll on mental health. The right specialist can not only help manage endobelly, but also provide guidance on other aspects of endometriosis management. Beyond medical treatments, lifestyle and diet play a crucial role in managing endobelly. Managing a condition such as endobelly goes beyond the confines of the doctor's office. It involves a holistic approach that includes the adoption of a healthy lifestyle and a suitable diet. The power of these two elements in alleviating the symptoms of endobelly cannot be overstated. Let's start with the role of a healthy lifestyle. Regular exercise, for instance, improves digestion and reduces inflammation. It helps to keep the body's systems functioning optimally, which can alleviate the symptoms of endobelly. Even gentle exercises such as yoga or walking can make a significant difference. Quality sleep is also a key factor. It helps our bodies rejuvenate and repair, which is crucial for managing a condition like endobelly. Stress management too plays a part. Chronic stress can exacerbate endobelly symptoms, so finding ways to unwind and relax is essential. Now let's turn our attention to diet. An anti-inflammatory diet can be a powerful tool in managing endobelly. This type of diet includes foods rich in omega-3 fatty acids, antioxidants and fiber. Think along the lines of oily fish, fruits, vegetables, whole grains and nuts. These foods not only reduce inflammation, but also improve digestion and provide the body with essential nutrients. Avoiding foods that can trigger inflammation is equally important. These can include processed foods, refined sugars, and certain types of fats. It's about creating balance, giving your body what it needs to fight inflammation and support overall health. Remember, each person's experience with endobelly is unique. What works for one may not work for another. It's about trial and error and finding what works best for you. By taking charge of our lifestyle and diet, we can take a proactive role in managing endobelly. It's about empowering ourselves and not letting endobelly control our lives. Endobelly is more than just bloating. It's a symptom that deserves attention and action. You see, endometriosis isn't just a singular condition. Like a chameleon, it adapts and changes, masquerading as other health issues. So if you're dealing with endobelly that persists or is accompanied by other symptoms, it's crucial to consult a healthcare provider. Why is this so important, you might wonder? Because bloating, while often associated with endometriosis, can indicate other health conditions as well. It's a bit like a wolf in sheep's clothing, hiding in plain sight. And that's why a proper diagnosis is of utmost importance. It's not merely about putting a name to a condition, but understanding what you're dealing with so you can combat it with the right strategies. In the world of health and wellness, knowledge is power. Knowing what's causing your endobelly can open up a range of treatment possibilities. It's like being handed a map when you're lost. Suddenly, you have a clear path to follow. And remember, reaching out for help isn't a sign of weakness. It's a sign of strength. It's an acknowledgement that you value your health and are ready to take steps to improve it. And there's a whole community out there, from healthcare providers to fellow endometriosis warriors, ready to support and guide you on your journey. So, if you've been brushing off your symptoms, thinking they'll go away on their own, it's time to reconsider. It's time to take action. Because ignoring the signs won't make them disappear. In fact, it might just make things worse. Remember, your health matters. Don't ignore the signs. If you or someone you know is dealing with endobelly, reach out to a healthcare provider. It's the first step to managing endometriosis effectively.